Hey guys, welcome back to my channel. Today we're going to be talking about Xanax and its class of drugs called benzodiazepines, also known as benzos or BZDs. I will probably refer to it as benzos for the rest of this video just because benzodiazepines is a long name to keep saying over and over again. But I think that this is important to cover because you hear a lot about the opioid crisis in the media, but what you don't really hear about is the benzos being, as addictive, if not more addictive, because they're just prescribed so often. So today I want to talk about what to look for and some alternatives to treatment. So let's get started. This class of drug, the benzos, are used to treat anxiety disorders, muscle spasms, seizure disorders, and it does this by increasing a neurotransmitter called GABA in the brain at its receptors. This puts our bodies in like a hypnotic sedative type state and calms us down. And it also increases the seizure threshold in patients, and that's why it's used for seizure disorders. From 1996 to 2013, we saw a 67% increase in patients taking benzos. That went from 8.1 million to 13.5 million people taking them. Now, unlike with opioid prescribing, which decreased when the opioid crisis started, we've seen a continual rise in the prescribing of benzos every year. Xanax, also known as alprazolam, is the most addictive medication in its class of the benzos because it has a really fast onset and it's prescribed fairly often. So some alternatives that we may want to use instead of that are going to be SSRIs, which are selective serotonin reuptake inhibitors, SNRIs, which is serotonin norepinephrine reuptake inhibitors, and then something like Buspar, also known as buspirone. And these are good alternatives because they're not as addictive as the benzos. Benzos are so addictive because they make us excrete excess dopamine in our brains. Dopamine is known as the feel-good or the pleasurable chemical that's released. So now we associate when we take this pill, we're going to feel good. We want to keep taking it over and over again. But over time, this reward pathway in our brain gets damaged, and now we feel like we can't even feel normal without having all this excess dopamine. So now we've switched from taking this medication to make us feel good to us taking it just to make us feel normal. And this is where the addiction really comes into play. Benzos are not drugs that you can just stop taking cold turkey if you've been taking them for longer than 10 days at a time. There's a lot of withdrawal symptoms that can happen if you do this, but the most severe one is going to be seizures. As we talked about before, benzos increase the seizure threshold in patients. So if you just stop taking them, you can make yourself start having seizures. If you want to come off of them, what you need to do is call your doctor, and they're going to come up with a plan of how they can taper you off of them slowly to keep these from happening. Some common side effects of these benzos are drowsiness, dizziness, lightheadedness, and some mild memory loss. So it's really important to not go out and drive your car, or operate any machinery. If you are just starting this medication, you want to give it a couple of days and see how it's going to affect you. And also, it's really important to not drink alcohol with this medication because they are both CNS suppressants. So when you drink the alcohol, it's going to increase all these side effects of the benzos that we just talked about. And if it becomes a habitual thing, that can also increase your odds of addiction. Unfortunately, overdosing on benzos is a very real thing in our world today. And I wanted to take some time to go over what we would need to look for in this case so that we can kind of know what's going on. So we're going to be looking for slow, irregular, shallow breathing. We're going to look for dilated pupils. They may have clammy skin, which just means it's cold but sweaty to the touch. They may have a weak but fast pulse. So you can check that here, or you could check it on their carotid up here. And they may possibly be in a coma. So what we're going to need to do is call 911 immediately because they're going to need help from a medical professional. They're going to need the reversal drug administered to them as soon as possible. That's it for this video, guys. Thank y'all for watching. I know that this video is kind of in a different direction than what I've been going in, But I felt like this was a really important one to do with how prevalent this is in our world and how it's not really harped on as much as an opioid addiction. So I hope y'all enjoyed it. And as always, if there's anything you want to see or have any questions about this video, drop it down in the comments below and subscribe to my channel. Thanks. Bye.